Good afternoon. The topic of my presentation is digital diaphanoscopy data processing for differentiation of maxillary sinus pathologies. Next slide, please. Today, 20% people in the world suffer from maxillary sinus pathologies, and in Russia, it's more than 10 million people every year. At the same time, these pathologies affect all age group, and untimely diagnosis and treatment lead to the development of serious complications. Next slide. На стрелочку. Да, ничего. Today there are different visual diagnostic methods for differentiation of maxillary sinus pathologies, but its use in clinical practice is limited due to high cost and complexity of the equipment and need for highly experienced doctor. Also, a high radiation load on the patient make it impossible to study pregnant women and children. Thus, timely diagnosis and treatment of maxillary sinus pathologies is an urgent health problem and has important economic significance. Please, next slide. Thank you. The method of digital diaphanoscopy is a safe and painless method, and it consists in translucent maxillary sinuses by anatomically shaped LED applicator with two radiation sources, visualizing the scattering pattern of light by CMOS camera, and the following digital processing of obtained images by specialized software. This method will allow to quickly and cheaply conduct screening diagnosis of population away from highly qualified specialists and to evaluate the quality of the treatment. Next. In order to justify medical and technical requirements for our device, we carried out numerical simulation of light propagation through maxillary sinus with different pathological changes. Our model includes 8 main layers and one additional layer in form of pathology. We took into account difference in anatomical features of male and female, and all optical characteristics were taken from the literature. This slide presents the result of numerical simulation for male with cystic fluid and with tumor inside of maxillary sinus. If you can see on the graphs, there is a great influence of anatomical features of male and female, namely the thickness of hypodermis on the result of diagnosis, and also there is influence of presence of pathological changes inside of sinus, and decrease of intensity light has more pronounced character in the near-infrared range, and it can be explained by great absorption properties of cystic fluid and tumor at the selected wavelengths. To carry out simulation in the case of purulent contents inside of sinus, we measured the optical properties of this pathology by spectrophotometer with an integral sphere model, and you can see that wavelengths of 980 nanometers is more informative for study sinus with PAS. So we carried out simulation for the case of purulent contents inside of sinus, and we use the wavelengths of 980 nanometers and established 4 different values of optical power for female and male. According to the results of simulation, we justified medical and technical requirements for our device, namely wavelengths of problem signal and the values of optical power for diagnosis sinuses of male and female. The next task was to conduct experimental studies of patients and conditionally healthy volunteers. Our research protocol consists of 4 main stages. It takes about 15 minutes. At the first stage, we registered patients in the database of our program. Then patients fill out questionnaire and sign informed consent. Then patient placed in the position in a sitting position, and then disinfected LED applicator placed in the oral cavity of the patient, and the head of the patient covered by protective screen with together with camera for exclude the influence of external lighting on the result of diagnosis. Then we set 2 different values of optical power for male and for female, and register a scattering pattern of light. So in this slide you can see the parameters of study group. It was 30 conditionally healthy volunteers aged from 18 to 27, and 21 patients with different pathologies inside of maxillary sinus. In this slide, you can see the results of study conditionally healthy volunteers, and you can see that there was no absorption of light in the area of right or left sinus, and we can conclude that there was no pathological changes. This slide shows the result of study patients with inflammatory diseases, and in the area of sinus with pathology, we can see the high absorption of light, and we compared our results with CT studies. The next slide shows results of patients with cystic fluid, and comparing our results with MRI studies. And as at the previous case, we also can see the high absorption in the area of sinus with pathology, and it can be explained by absorption properties of cystic fluid at the wavelengths of 850 nanometers. In order to get diagnostic criteria, we developed algorithm for classifying of maxillary sinus pathologies, and it consists of 2 stages. At the first stage, we get the intensity parameter. It's amount of light that reached to the detector camera after absorption by different biological layers. And the next, we calculated the coefficient K. It's percentage ratio of intensity in the eye socket area to the intensity in the sinus area. This slide, the next slide, please. This slide presents the result of data processing of calculated parameters, and the boundary between the normal condition of sinus and the sinus with pathology is clearly traced. In the future, we are going to, we developed the methodology of conducted study by our method, and the conclusion about presence or absence pathological changes inside of sinus made by calculated parameters. In the future, we are going to develop new LED applicator with wavelengths of 980 nanometer and continue to set experimental data. Also, we are going to apply the neural networks for classification of areas of pathological changes. So thank you for your attention.